Meniere's disease. Meniere's நோய் சொல்ற காது கேளாண்மை, காது இரைச்சல் அண்ட் காது அடைப்பு இல்லை இந்த டிசீனஸ் நம்ம சொல்ற கலக்கர்கள் எல்லாம் சேர்ந்து வர ஒரு சிம்டம்ஸ். மூணாவது பார்த்தீங்கன்னா அக்யூட் பெரிஃபரல் வெஸ்டிபுலோபதி ஆர் யூனிலேட்டரல் வெஸ்டிபுலோபதி. இது காமனாக வைரஸ்னால வரலாம். நாலாவது பயலேட்ரல் வெஸ்டிபுலோபதி. அது நிறைய கண்டிஷன்ஸ் இருக்குது. கான்மையில வரலாம், ஆட்டோமியூன் டிசீஸ்னால வரலாம், மெடிசின்னால வரலாம். அஞ்சாவது வெஸ்டிபுலர் பேராக்சிஸ்மியா அப்படின்னு சொல்லக்கூடிய கண்டிஷன். இந்த பிளட் வெசல்ஸ் வந்து உள்காதுலேருந்து போகிற நரம்பை அதை டச் பண்ணுறதுனால வர டிசீனஸாக இருக்கலாம். ஆறாவது சுப்பீரியர் செமிசர்குலர் கெனல் டெய்ஸ்ன்னு சொல்கிற இந்த மேற்புறம் உள்ள நம்ம அந்த உள்காதுக்குள்ள உள்ள மேற்புறம் உள்ள சுப்பீரியர் செமிசர்குலர் கெனல் சொல்லுவோம். ஒரு கால்வாய் மாதிரி உள்ள அரைவட்ட கால்வாய். அதில் வந்து சிதைவு இருந்ததுன்னா, அதில் இந்த போன் வந்து சிதைஞ்சிருந்ததுன்னா அப்போ கூட டிசீனஸ் வரலாம். இந்த மாதிரி 6 காமன் கண்டிஷன்ஸை நம்ம பார்ப்போம். இந்த நான் சொன்ன அது மாதிரி உள்காதுல ப்ராப்ளம் இருக்கா நம்ம டயக்னோஸ் பண்ணுறதுக்கு we need to consult the ENT specialist and the centralized combined neuro-ENT will solve this problem. Thank you.
Thank you. I'll call upon Dr. Arul Selvam. So, senior concerned neurologist. Why is diagnosing vertigo or any other balance disorder assumed complicated?
Good afternoon, everyone. So, the vertigo, I can give just one example. The difficulties faced by patients as well as doctors. So, ஒரு vertigo patient வரும்போது பேஷண்ட்க்கு தலை சுத்துது. நிறைய வாட்டி டாக்டர்ஸ்க்கே தலை சுத்தம். ஏன்னா they have difficulty in diagnosing because it falls in multiple areas. அதாவது இப்போ ஒரு ஹார்ட் அட்டாக்னா கார்டியாலஜிஸ்ட் அந்த மாதிரி இல்லாமல் இந்த தலை சுத்தல் பல காரணங்களால் வரலாம். Some may be general medical problem, some may be neurological problem, some may be ENT problem. But still, we need somebody who is having special interest, who is experienced in this to really make this difference. So, for example, I can tell you about one patient who said, "Sir, I am having severe giddiness for nearly 1 year. I have gone to general medicine, I have gone to psychiatry, I have gone to orthopedics, I went to ENT, I went to neurology. Finally, after spending nearly 50,000, different scans were done. Finally, I went to this neurologist who finally made the diagnosis. This neurologist said, you are suffering from vertigo. Now I became very happy because I got a diagnosis. Actually, even that neurologist did not make any diagnosis. Just what he said, thala suttadu, the neurologist translated to vertigo and said, you got vertigo. Patient is happy, at least somebody has told some term, because otherwise people are telling it is because of high BP, low BP, high sugar, low sugar, spondylitis, like this. So vertigo is something which needs some amount of experience and special interest for a doctor to diagnose, because இது வந்து subtle science இருக்கு. நார்மலா பார்க்குற மெடிக்கல் சயின்ஸ் எல்லாம், even medical education itself, it's a blind spot. There is no proper education at the undergraduate, postgraduate level till now. Only now things are changing. So அதனால வந்து இந்த பேஷண்ட்டுக்கு வந்து வரும்போது இந்த பர்டிகுலர் செட் ஆஃப் டிசீஸ், இது வந்து ஜெனரல் மெடிக்கல் ப்ராப்ளம் இல்லை, சைக்காட்ரிக் ப்ராப்ளம் இல்லை, இது இந்த டிசீஸ் அப்படின்னு கண்டுபிடிக்கிறதுக்கு சில எக்ஸ்பர்டைஸ், சில ப்ராப்பர் எவாலுவேஷன் இஸ் நெசசரி. ஸோ தட் இஸ் த ரீசன் வை பீப்புள் கோ ஃப்ரம் பிளேஸ் டு பிளேஸ், அண்ட் எஸ்பெஷலி இன் அ பிளேஸ் லைக் இந்தியா where they have easy access to the doctors. For example, in many western countries, if you want to see a vertigo specialist, you have to wait for 2 months. So by the time most of the vertigo itself becomes all right, or the patient had so much problems, they finally end up with psychological issues. Whereas here, the first day they have morning they have vertigo, evening they can come and see. And for example, there are some vertigos which can be instantly treated by doing some positional maneuvers. So the next day they are fine. So that advantage is there in a place like ours, where patient can have easier access to the right person. If they come and they get treated early, it will make a big difference.
Thank you, sir. Now I call upon Professor Dr. Michael Stroop, the tallest and most respected figure in this field, from volunteering in working in Dharavi 30 years ago. And he comes to India regularly to upskill doctors. And myself and all these people are testament to that, we have read his books, we have attended his talks, and we are here because of his efforts. Thank you. Please.
Namaste, namaskar, shukriya. After these introductions, I'm afraid I can only disappoint you. So I just want to make a few statements about chakra. Chakra has a very bad reputation, and this was already stated by my kind colleagues. But actually, if doctors are well trained, then even general practitioners can make a correct diagnosis in 90% of the patients. In other words, you don't need these specialized doctors for the majority of patients. What is required that we improve the diagnostics in vertigo and dizziness. Education, 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 and self-confidence by the doctors that they know, yes, I can. And this should already begin in medical school. Although vertigo is so frequent, in medical school, in university, it's treated like an orphan disease. It's not part of the curriculum in a proper way. The second problem, and this is noticed by the colleagues here from ENT and neurologists, is that patients fall between the chairs of ENT and neurology. And although the title here is integrated, let me tell you, it doesn't work in clinical practice properly. So to put it in a positive way, the doctor who sees patients with chakra should be well trained. What are the keys to the diagnosis? So first of all, speak to the patient, listen to the patient. I see a lot of patients every week, general neurology, on my own. And my first question is, Dr. Prabhash, why do you come to our hospital? And he will tell you the story. He's the best and primary source of information. What I actually do not do is to look at the files for two reasons. Either the diagnosis is already correct, then it's boring. Or the diagnosis is wrong, and then you are biased and have to make a U-turn. And the four key questions when a patient comes with chakra are very simple. First, the time course. Does the patient have episodes of vertigo, an acute onset, or persisting symptoms? The next aspect is what type. But that's waste of time because most patients do not discriminate between spinning vertigo and postural imbalance precisely, or they have both. The third aspect are provoking factors. Do the symptoms occur spontaneously, or are they provoked by anything, turning around in bed, for instance? And the fourth category is accompanying symptoms. As you noticed, they can arise from the brain, from the extrapyramidal system. Almost all patients with Parkinson's, they initially complain of dizziness. It can be brainstem stroke with double vision. It can be hearing problem as in Meniere's disease. It can be headache as in vestibular migraine. So this is very important. Accompanying symptoms, provoking factors, so these are the four aspects. And then I examine the patient. And for examinations, we have just four tests. I look at the function of the vestibular reflex by turning the head to the right and to the left, do the diagnostic positioning maneuvers, have a careful look at eye movements, do the positioning maneuvers for BPPV and the Romberg test. Then you have a diagnosis. You don't need machines. We have reclassified all vestibular disorders over the last 15 years. Doctors can download the diagnostic criteria from the Journal of Vestibular Research for free. And if you read them, you will notice almost no machines. It's about brain work, it's about listening, it's about physical examination. And this can be done by any doctor. Only 10% of the patients do need specialized centers like here, but the vast majority, and here in India, you have about 450 million people with dizziness. Yeah, so it's a huge population. This should be handled by the GPs, and very few come here. And once you have made the diagnosis, we can treat patients. Straightforward. The first thing is tell the patient what is the diagnosis. They need to know what they are suffering from. That's a great relief. And then we can have physiotherapy, we can have medication like vHIT in Meniere's disease or other diseases mentioned, very rarely surgery. And one category which is often neglected, this is called functional dizziness. Patients are permanently dizzy because they permanently check their own balance. And this has to be diagnosed. It can be primary or secondary, and the treatment is speak to the patient and tell them what they should do and what not. So, my take-home message is, yes, we can. We need well-trained doctors. That's step one. Begins at medical school, and then we need doctors who know, yes, I can. And then it's really nice to have dizzy patients. You should love your dizzy patients, and they will love you. So it's a win-win situation, and you improve functioning and quality of life in 90% of your patients. So be optimistic, straightforward, like your dizzy patients, and they will love you. Shukriya.
Thank you, Dr. Michael. Such an insightful session. Thank you, doctors. May I now request Frida ma'am to please address the gathering.
Namaste, all our amazing clinicians on the dais, and Dr. Strum, thank you for igniting this flame. I think it's because you were coming back and forth that we thought, let's launch this whole clinic. And I must say that the reason why we've launched this clinic, there is also a personal reason that we have had this issue with a very the most important member in the family, I must say, and all our clinicians here have been working 24/7 to look for solutions. And that is probably the reason we said that, if we have this thing, doctor said, Gera, Tala Suttadu, Dr. Strumpf, when he said chakka, it was chakkar, hit me chakkar. This dizziness, we all kind of take it a bit lightly and we take it for granted, and it's happened to us. And we run hospitals, we do cutting edge technology for cardiac work and cancer work, and we do so much in the hospitals. And the simple thing about dizziness, we kind of say, yeah, it's okay, it may happen because of so many reasons, and sometimes we don't understand the suffering which the patient has. We don't understand the intensity of what the patient is going through or what the person is going through. And that is when I think, with all our doctors, all our clinicians, they have come back and said that vertigo is an issue and vertigo is a problem. And it is not something which just the neurosciences division treats or just the ENT treats. It's actually a combined and it's an integrated program. And I think that is why it's very special that, Apollo has launched it as a clinic. And we're doing this more out of raising awareness, more out of service for people. And we know that it's the general practitioner where the patient goes to first, where people go to first. So it is for them to realize that we have solutions. And there's some fantastic and cutting edge, believe me when I tell you, cutting edge solutions that all these doctors on the stage have done. They have treated a few hundreds of patients. But why are we doing it as an integrated clinic? Is because that we want thousands of patients to benefit from it. And I'm so thankful that Dr. Strumpf and Dr. Dan, who's going to be joining us in the conference a bit later, are going to put this whole system and protocol. And when we launch, anything which we launch with Chennai, thanks, and I must thank the members of the media and the press, that it always does well throughout the country, and we get people from overseas. We treat people from 150 countries. So there is something about starting a program in Chennai that it really does very well. And the intention is service. And that also I think is the right way to handle for anything in medicine. And Dr. Dan is coming, and he is the specialist in ENT. We've got Dr. Strumpf, who's a neuro. So, both of us are going to hold this conference. Both of them together will hold the conference. And we have our integrated team who will handle this issue of vertigo. Also, there's this whole problem about balance. And many of us don't realize it. But the moment you get, you cross 60, if you're exercising and, you're very active, you will hit 70 and you'll do well. But the moment you hit 70 and you find that there are issues of balance, it needs to be addressed. And so this focus on balance has many repercussions if you don't do it right. And this clinic will be doing that also, that it's an area which is kind of ignored. So I think Dr. Prabhas has come up with this dance for balance. I loved it because I'm a dancer myself. But I think it's a great thing to do, because one is it puts some joy in what you do, and it also focuses on making people well. And I think that's the responsibility which Apollo has. There is one piece which I want to mention to our clinicians and to all of you. The thing about Apollo is that we're never satisfied with just what is enough, what is done. We want to take it much further. And here you have the power of technology and the power of AI. We have 200 people sitting in Hyderabad who are focusing on the clinician's intelligence engine. And that will actually help you with the protocols, and the fact that we're collaborating with some fantastic people like Dr. Strumpf, that we will really have a solution which is backed by technology, by AI, which will be available to the GPs, so that it will help them diagnose and it will help them give the patient a holistic answer and a holistic solution, because they really deserve it. Every patient deserves the best. And our mission statement was that we will give healthcare of excellence, which is available anywhere in the world to people of our country. But what has happened is people from other countries are coming to India now. And that is the pride of being an Indian. And I think by doing this, you will set one more stamp on the pride of India. So thank you all our doctors for doing that. And there is just so much more to go, miles to go before we sleep. Thank you so much, but we'll keep dancing, by the way. Thank you so much, and namaste.
May I request Preeta ma'am to please honor our doctors. Yes. Dr. Michael Strumpf.
Lo. Ramana, into left.
Dr. Prabhas. Dr. Arul Selvan. Dr. Venkat Karthikeyan. Dr. Vijay Shankar. And Dr. Karthik Manish. May I now request Mr. Naveen, CEO Apollo Hospital, to felicitate Dr. Michael Strumpf.
Actually, I have been to India for at least 50 times.
First one, the benign paroxysmal push-pull vertigo. I'm going to change it to peripheral paroxysmal push-pull vertigo, as advised by the great expert Dr. Michael Strumpf. The second thing